Welcome, everybody. It's 7 o'clock, and so it is time to begin. Thank you all for being here. We really appreciate it. I want to thank so many of you who were also able to be at the school board meeting on Monday night. So we really appreciate the fact that so many people were able to watch that also. So once again, thank you. And I know that there are many questions about the upcoming school year. And we are receiving questions from our families, community members, and certainly our staff. So that's why it's so important to have this listening session tonight so that I can share with you what I know at this point. And while nobody has all of the answers in this situation, I think it's important for us to connect and to keep an open dialogue about what I know and what I can let you know. So before we dive into any part of this discussion, I want to make sure that everybody knows that our number one priority right now is health and safety. And that is health and safety for everyone, for our students and for our staff. So if you walk away with anything from this evening, I hope you walk away feeling secure in the knowledge that the health and safety of our students and our staff is the most important thing to us. So right now, I will turn to the agenda, which means I will be sharing my screen with you. Just one moment. All right, so here we go. I want to share with you the agenda. So the format, I'll have an abbreviated presentation. The presentation on Monday night at the board meeting probably took about an hour. And when I did the listening session with teachers on Tuesday night, I think I was able to pare that back to 38 minutes. So I expect that tonight the presentation will be about that much. And then we'll move into a question and answer session. And you have already been sending in questions, and we're very grateful for that. I think we have about 200 already. Because of that, we grouped questions based on themes. And so we'll be answering questions or we'll be giving you information around those themes. And we'll provide you the information that we have on that. So overall, for housekeeping, wanted to let you know that this is being live streamed through OCA Media. So if people aren't able to watch it tonight, they can certainly watch it later because it is recorded. And it's important to note that I'm unable to manage the chat feature during the session. So I'm really focusing in on the questions that you already sent. So if you're asking me something or making a comment in the chat session, I can't even see it. From my screen, all I can see is my presentation. So please don't feel that I'm ignoring you. I simply can't see it. So it won't be a feature that we'll be focusing in on tonight. I will focus in on the questions that were already sent to us. Before I jump in, I just wanted to say once again, thank you. We're happy to have you here. We really appreciate the fact that you sent in so many questions because that only makes for better communication. So, our reopening schools working plan. This is what was presented to the school board on Monday night, July 13th. And overview, well, we'll start with talking about what are our guiding principles related to how we are making this decision and how are we working as a school district? What's the working structure? Because this decision is so complex and has so many components, how are we keeping that all aligned and organized? Then I'll talk a little bit about possible pathways for reopening schools, what we consider to be our next steps, and then I'll be answering the questions and considerations that you put forth when you sent them in earlier this week. So first, I want to call attention to what we're considering to be our guiding principles when we're trying to work through what is the very best option for the fall. So as you notice, right in the center are our 5 values. The apple that you see in the center of this particular diagram. And we start everything. We start all initiatives and projects looking first at the values and how do they inform our thinking. However, this is not an initiative or a project. This is how we will operate and this is how we will keep our school community safe. So that's bigger than any initiative, and that's why the 5 values are a really critical starting point. And you'll also notice that the word equity has brought out strong over our values. You know that equity is one of the Oregon School District values, but when we're trying to understand how to best reopen schools in the fall, equity is one of those lenses that we apply to all things. We think about how all of our students will be impacted and what can we do to mitigate negative impacts on any of these decisions that we need to make moving forward. So health and safety, as I mentioned, that is absolutely paramount. So we are making decisions that reflect the national, the state, and mostly our local partners. Public Health of Madison and Dane County have been an amazing local partner, and they have helped us tremendously because they are the ones that have information on the data that is local, and it's local data we should be using to think through this decision. And it's really important to note that other counties that surround Dane County may or may not be getting similar guidance from their public health department. Consequently, if you hear about a community in a different county and they're doing something completely different, that may be because the data coming from their county or the guidance coming from their health department is different. So just note that you may see differences across southern Wisconsin. Of course, the other component that we look at all the time is how are we positively impacting mental health and social emotional learning. They're really critical, and we know how difficult it was when schools closed so abruptly. And then when we found out we weren't coming back at all for the year, those were really tough things. And they had an impact on kids, and they had an impact on families and our staff. And so that is something that we're continuously thinking about and planning for, how to be more and better supportive of those critical issues. And of course, high quality education. We are a learning institution. We want to have an opportunity to serve up the very best education we can possibly serve up to our children. And we want to be able to optimize instruction no matter the mode. And I think it's really important to point out that we did close abruptly, and our teachers did an amazing job of switching the way they delivered the learning experiences to our students. And they did it rapidly, and they did it well. However, in the fall, we learned a lot from last spring, and we listened to the feedback that came from you and that came from our students. And so we do have plans for being able to improve the quality of any of virtual learning, no matter when it comes in to the plans for next year. And then finally, flexibility and adaptability have to be a part of how we're looking at things. And we'll talk more about it later, but honestly, we know how rapidly things are changing. What we thought was the case in mid-June, we are finding now is different. And that's just how rapidly things are changing around us. And consequently, whatever our plan is, there has to be a degree of flexibility and adaptability. So how are we organizing this? Because it's a lot. And so it's really important to know, for you to know, how all of these pieces are fitting together. Well, the district office administrators comprise the steering team. And our steering team meets 2 times a week. And each of the district office members are facilitating either a committee or multiple committees that come under the headings that you see here. So Director of Learning and Student Achievement, John Tanner, and the Assistant Director of Learning and Student Achievement, Darcy Yarsted Krieger, are working on the academic planning component of our plan. So that means that anything that is preparing us to optimize instruction, no matter the mode. And they have 50 different people on those committees. And yes, you heard that right. They have 50 different people. And they're staff members who are working together to ensure that whatever the fall looks like, it's the best possible learning that we can offer our students. So I'm really impressed and pleased that there's so much staff participation in this committee and the others. Dr. Candace Widensee leads the committees that are planning for mental health and social emotional learning supports. And once again, those committees are comprised of our staff members. Andy Weiland, our business director, he is facilitating 3 different committees. Facilities, food service, and transportation, and all of the safety and planning safety protocols and planning that go into those 3 operations committees. Gina Jonan is our HR director and legal counsel, and she is, of course, working on all of the human resources aspects to planning for the fall. And Erica Mundinger is our communication director, and she tries to organize us all into a consistent line of communication. And that is very appreciated because, as you can tell, there is a lot going on. So, as the steering committee is working, and we're talking about our possibilities, and we are working with our OSD colleagues and planning for the future, because that started a long time ago. I don't want anyone to think that we started planning for the fall a few weeks ago. We started planning for the fall as soon as we understood we weren't coming back for 1920, because we knew what type of planning was required. So we started on it early, and we've been working on it this entire time, and we'll talk about that a little bit more later. But right now I want to show you what are the sources of guidance that we have been using as we're doing our planning. And I mentioned previously, Public Health of Madison-Dane County has been a significant partner. And I'm really appreciative of all that they're doing for all of the Dane County schools, because just as one example, I'm on 2 different phone calls with them each week. One is a statewide or a sort of a South Wisconsin call where public health is a component of it. And then also every week they have representatives on our Dane County superintendent's meetings. So public health has been absolutely integral to all of this. And then I don't have to read the whole list. You know that there are really important partners and sources of information. But one of the things that I really want you to pay attention to is the fact that these listening sessions and the types of questions that were submitted by our staff and by our families, and the surveys. We sent out a staff survey yesterday, and you will be receiving a survey tomorrow. And those surveys are part of the data set that we need in order to plan forward, because we want to be able to look at all of the information, including what our staff thinks, because they are our partners in this, as are our families, and all of the input matters. So now we'll get into what the possible pathways are for reopening. And please note, possible pathways was chosen for a reason. There isn't anything that is 100% at this moment in time. One of the reasons that nothing is 100% is because there is no decision that can be made without the input of the families and without the input of the staff. And you're having your opportunity to give that input through the surveys that are coming out this week. So now we'll talk a little bit about what does it possibly look like? Well, similar to the rest of Dane County, because I'm sure you've read articles or heard other people talking, there really are 3 possibilities. And the first is, of course, the one that everyone would prefer, and that is having all of our kids with us and having the right accommodations and distancing and symptom monitoring, etc. However, that can only happen if it can happen safely. And then other option that we are considering is the blended option, which is the option that allows us to bring in a cohort of students that are then separated into small groups of 15 or less, so that we could do some in-person learning and some online learning. And then the third option that we're considering is that should there be a part of our year next year where we are simply virtual due to safety concerns. And we'll talk a little bit more about that in a little bit too. So how would we decide? What are the factors that impact model selection? So I just want to talk about that a little bit so that everybody sees how all of these pieces fit together. So first of all, capacity requirements in the building. Now, thus far, public health hasn't given us a building capacity requirement. That was something that was floated a while back, but that is not where we're at today. However, I am expecting that we will get capacity requirements for common areas. For instance, a cafeteria none of this has happened yet, but it might be something like 50% occupancy as long as you can ensure 6 feet of physical distancing between students. That's one example of what a capacity requirement might be like. Social distancing requirements exist. Public health just sent something out this week that said 6 feet of social distancing for students in the fall whenever possible. And that phrase, whenever possible, does not mean that you can put more students in a classroom. It's just an acknowledgement of the fact that students may on occasions pass within the 6 feet physical distancing space that we're trying to reserve for each child in order for something to happen, whether it's to get to the sink or to walk out the door or whatever it happens to be. But 6 feet, when we map that out in our classrooms, that means probably a maximum of 15 students per classroom. Another integrated or interrelated factor is the cohort model. And that is the advice of public health, and it's certainly in alignment with all of the advice that's coming from other organizations, such as the CDC, is that they're saying that if you can take and put a small group of students together and not mix that small group with other groups, it is safer for the teacher, it is safer for the student, and if someone were to become infected, it requires, it has better contact tracing, basically. If there are only 15 people in a small group, then it's only 15 people that would need to quarantine, as opposed to a larger class or when students are mixing quite a bit, which really would happen at the high school and the middle school, because our students aren't in cohorts in either of those schools, meaning they have so many different choices in the classes that they take that putting kids together that take the same classes all day just isn't really possible. Consequently, in those two schools, we would look at reducing or decreasing the number of passing times or staggering passing times or doing anything that we could do to ensure that there were fewer students in the hallways at one time. Facility space. So if we know that the social distancing requirement is 6 feet per student, and we know that that means 15 students in a classroom, as an example, if we looked at that for Prairie View, that means Prairie View would need 6 more classrooms. Well, due to the fact that we just built Forest Edge, we do have some extra space at the K-4 level. And so we may be able to find 6 classrooms. That's not really the issue nearly as much as it is the next piece, which is the teaching staff. Because if we want our every one of our students in cohorts or small groups of 15 or more to have a certified teacher, that means that Prairie View, as an example, would need 6 additional teachers to operate at the 1 to 15 ratio and have everybody in the building at the same time. There really isn't the facility space at the middle school. The middle school already has, I think it's probably 675 students planning to be there next year, and that means that there aren't a lot of rooms. And so there wouldn't be a way to have every single middle school student attend and meet the physical distancing requirements that public health has put out. Family needs are a gigantic factor because we all understand how challenging it is if students are going to school a couple of days a week and then online a few days a week, or if they are completely online in a virtual option. That really impacts the families. And we absolutely understand that. And we're working to try to find ways to be helpful in that regard, because we know that that is a burden. In addition, every solution we look at through the lens of equity. Who needs extra supports? Who would benefit from additional time? And how do we ensure that we're giving every student what they need when we know that the environment is not ideal? Finally, we are working with other Dane County schools because we're all working with the same information set. And so cooperating with one another and sharing ideas and talking about reasoning and rationale is a really important part of the process. And then finally, as I mentioned, when I mentioned equity and everything else related to safety, is that we are using our guiding principles and we're talking through each one of the models that have any potential, as well as how it's impacting all of the different people who are in the community that we serve. So when I said most likely option as of today, that was Monday the 13th. So as you know, things change very rapidly. And I don't know if I would say that the blended model is the most likely option right now. It's one of the options, but I don't know if I would put it as the most at the moment. What we do know is that we have a completely online option for those who prefer it, and I will talk about that in just a minute. And in any of the models that we look at, whether it's blended or it's virtual, if we have greater capacity, we will prioritize bringing in our youngest students first, bringing more of them in first. And I'll talk about why in just a little bit. So now I'll talk through the guiding principles a bit so that you can understand some of the things that we've been talking about. So for the health and safety guiding principle, there are 4 areas that we're looking at. And I will start with physical spaces. So some of the things that we know we're putting in order, for example, are plexiglass barriers at reception desks. We know that the 6 feet of physical distancing is critical for safety. Consequently, when we look at classrooms, there may be some removal of furniture because we want to be able to ensure that we're using up as much of the space as possible so that we can have 6 feet of distancing between our students and still potentially have 15 students in that classroom. We'll be modifying building layouts, meaning we're adjusting traffic flows. There will be some hallways that are one-way traffic only in order to reduce students passing one another. And yes, that will be tricky. I know some of you are probably trying to imagine how in the world we do that. And yes, it would be tricky. And we are putting decals on the floor to help students understand what direction the hallway is supposed to move, and also to help kids understand what 6 feet apart means, because that's a really hard concept, honestly, whether you're 5 or 15. That is a hard thing. So being able to have markers on the floor to help kids understand that is definitely a part of the plan. We'll also relocate some classrooms when possible, because there are some rooms in the building that are simply bigger, and so we will try to use those in a very strategic way. We'll definitely stagger our locker use because students shouldn't be right next to one another in their lockers. It certainly wouldn't be able to use physical distancing in the right way for that if that were happening. We'll have increased protocols for communal spaces. We'll definitely have safety signage and markings on the buildings to help students understand the expectations related to where they are and washing their hands and all of those important pieces. We also know from public health we need to have an isolation room in case anyone within the school begins to exhibit symptoms of COVID-19. We wouldn't necessarily send them straight to the health office. We'd send them to sort of health office number 2 that is reserved specifically for people who have symptoms that may be related to COVID. And then finally, there is a staff training component to all of this too. Not only will our students need to understand all these health and safety protocols, but so will our staff. So the healthy environment component, that's really about the cleaning and disinfecting processes. And a lot of that comes to us from public health, what the expectations are. I know that in the past there are a lot of shared objects, particularly among elementary school students, but for now, individual supplies is what we'll be focusing in on. Of course, hand washing. No matter who I speak to in the medical community, I hear physical distancing, masks, and hand washing. And so that is something that if we're fortunate enough to have our students with us, we'll be frequently focusing in on that. We also are working on increasing the ventilation systems in all of our schools. And actually, we already have really great systems. So for any of you who may be people who know a little bit about HVAC, we're moving from a MERV 8 to a MERV 13. So if that means something to you, I'm told that that is a significant improvement. Daily health screenings, we aren't exactly sure how we will do that at this moment. We're not saying that we are taking the temperature of every child who comes in. We're waiting for some guidance from public health related to that, because we are expecting that if we are fortunate to have kids in the building, that parents are ensuring that before any children come to school, that they are symptom-free. And if they are not, they are staying home. And it's the same for our staff. We'll be encouraging them to stay home if they are ill. And of course, there absolutely must be a potential positive case protocol. It's a requirement from public health before any school building opens in the fall. They plan to give us a specific protocol that we can use. And they said it will come to us, and it will come to us before September 1st. Meanwhile, they refer us to the Child Care Center's positive case protocol for any guidance or indications of the expectations. Daily routines. As I mentioned, if we are fortunate enough to have our students, we will be doing everything we can to keep them in the same small group. When they are in the small group, that does not mean that there is not an expectation of physical distancing. There still is. And that's an unfortunate thing, but that is part of the guidance that's coming to us. And there would be very limited interaction with students outside of that small group. And instead of students moving from class to class in the lower grades, it would be teachers rotating. And we're working on ways to do that, other ways to do that in order to limit the number of adults that are even coming into the room. As you know, face coverings are a Department of Health mandate right now, and that includes for students and staff. And we know that it's an essential part of being able to open the building in any way, is to ensure that everyone is wearing face coverings. Now, are there exemptions for people with disabilities? Absolutely there are. However, face coverings is something that we will need to be very stringent on, because that's key to safety. As far as food, the younger children are probably going to have lunch in their classroom because, as I said, keeping them in a small cohort, small group is pretty critical. We'll be rotating the use of the cafeteria for older students. And entrance and exits, once again, we will be designating different entrances and exits for students depending on where their classrooms are in the building, because we cannot create a bottleneck at any one entrance or exit in the beginning or end of the day. Scheduled health breaks for hand washing, and thankfully, public health is helping put together some protocols for mask breaks. For instance, I was on a phone call today that said the expectation would not be that students have to wear their masks at recess, which is great, except they really should only be having recess with their small group. So recess as it existed when the entire grade level goes out after lunch, that wouldn't be possible with these protocols. The students will still have recess. It's absolutely vital, perhaps more vital now when they're not moving around from room to room as much. However, they would have time with their small group of 15 or less. We're absolutely considering creative staffing solutions, and people have been sending in some really great suggestions, and I appreciate that. And we're also looking for ways to limit the travel between buildings, because we know that some of our teachers or some of our educators are in multiple buildings during the day, and we want to try to find ways to absolutely limit that. And then visitors. Unfortunately, we will be limiting visitors. There will be no non-essential visitors to the school buildings, because we are trying to limit the number of adults that our students come into contact with, and the number of adults that our staff comes into contact with. Transportation. This one is tricky, because even in conversations with public health, they completely understand that there probably aren't enough buses in all of Dane County to put every child who rides the bus 6 feet apart. Consequently, some of the recommendations that we've seen so far are related to assigned seating. so that if there is a case, then we know if a student was positive, we know exactly who sat near that person on the bus. We also would be asking for 1 student per seat, except for siblings. We would love it if siblings sat together because they are already part of the family unit and they can sit closer together than 6 feet. We are expecting our students to stay seated and to face the front. We'll open windows whenever possible, and of course they must wear a mask. So I'm sure you're asking yourself, how in the world would the bus driver be able to ensure all of that is happening? And that's a great question, and it's one that came out of our transportation committee too. Consequently, we're considering bus supervisors for this time period to ensure that the safety protocols are adhered to. And of course, we'll be disinfecting and cleaning buses after each route. We, of course, will be modifying buses depending on capacity and need. And we will ask that if it's possible for you to transport your children, then please do so, because we want to be able to have as much room on the bus as possible for the students where that just isn't an option based on when their parents are working. And we'll be doing some modification to drop off and pick up zones because we can't have large clusters of people in either of those scenarios also. So the last few slides have really been about, if we are in person, what are the safety protocols we'll be putting into place? Now I'd like to talk a little bit more about what the actual options are and some of the details of those options. And you had some excellent questions related to this. We're planning, and we have been planning since May, for all 3 of these possible options. And of course, our goal, number 1, is health and safety, and then always to provide the best possible instructional experience for our students. And so our first choice really would always be to have our kids with us in person, because we know that relationship that's built between the students and the teacher and the classroom community, all of that is absolutely critical, and it's much more difficult to do in a virtual environment. Not impossible, just difficult. And there are lots of learning experiences that are simply better in person. However, when we put safety as the number 1, I think it's pretty fair to say that at this point in time, having every one of our students coming to school, even with all the proper safety protocols, is really one of the options that's in our rearview mirror at the moment. It's extremely unlikely for September 1st. So I just want to be super honest about that. And if you think about the fact that we have the 6 feet physical distancing protocol, we can't even do that in the middle school or the high school. There isn't the space and there aren't the teachers to make that happen. If we can make it happen, we would prioritize making it happen for the younger students first, because it's much more difficult for them to learn in a virtual environment. And building foundational skills is really better done in person if possible. So I'll go on to the blended for just a moment, and I'll talk in more detail about blended and virtual in just a moment. But first, I wanted to make sure you understood a really important distinction. So the in-person, the blended, and the virtual, those are formats that may occur at any point next year. We could actually be moving from one to another based on public health guidance. But if you decide you are starting with us, no matter the format, you are going to take that journey with us, and you might move from blended to virtual or virtual to blended or whatever it happens to be, then we'll call that, for the sake of this conversation, you'll be with the OSD implementation, whatever Oregon School District is doing according to the public health guidance. But you do, as parents, we are making sure you have the choice to do it differently. So for those of you who, either for medical reasons or because you know that your child thrives significantly with predictability, or whatever your personal reasons may be, if you would like to commit to a fully online program next year, we will be able to make that happen for you also. But if you decide to commit to that, we would hope you'd commit for at least a semester, regardless of what the model the district is implementing. However, your needs as a family and your child's needs as a learner are always first. So if you choose Oregon Online and you decide you want to commit to fully online learning, but in a few months you say it's not working, I want my child to do what all the other children in the district are doing, then of course we would make that switch for you. Because more than anything, we want to be able to meet the needs of our students and our families. So we wanted to make sure you understood the difference. We could have a whole all virtual for everybody, but that would be separate from Oregon Online, because Oregon Online will be the people who are committing to online learning all year, no matter what. So just to talk about the in-person model a little bit, I've already mentioned that we would prioritize bringing in our youngest students first. If we are able to bring in groups of students, then they would be the first ones to come in. In a blended learning model, there is a lot of discussion out there about blended learning, and I completely understand why this throws an absolute wrench in planning. But it really, what it's about is having our students have at least 2 days a week where they are in person, and the rest of their time would be online. And the way we have considered it, although I'm getting some great suggestions from people in the community, the way we have been considering it thus far is an alphabetical split, because we want families to all attend school on the same day, because that's simply easier for family planning. And when you have children who are older who may be able to supervise the children who are younger, then it becomes something that's absolutely necessary. Now, we know that not all families have the same last name, so of course we would do all the modifications that would allow families to attend school on the same day. I know also from your questions that there are some families who would love to be able to help each other out. And in order to be able to help each other out through this difficult time, they would want their children to be on the same schedule. And we would do everything we could to accommodate those needs, as long as we weren't making any classroom larger than it can be with the physical distancing requirements that we need to adhere to. Now, whether a student attends school Monday, Tuesday, or Thursday, Friday, and Wednesday is our day where everyone is doing virtual learning, all of our students, our staff are collaborating, and our buildings are being deep cleaned. Or if we do students on Monday, Tuesday, clean in the evening, students on Wednesday, Thursday, and everyone is doing virtual learning on Friday, and the buildings are being cleaned and the teachers are collaborating. I know that a few people have suggested that perhaps we could do a full week of, let's say, cohort A and a full week of cohort B, and there is merit to that suggestion also. It's just that I know that if our educators have the opportunity to do so, they want to be able to see each child every week. If they have that opportunity, they would consider that to be important. Internet access, we're working to improve that, and there have been some really great developments in that lately. We are very mindful of our staff who also have childcare challenges. They are in the same situation as many of our community parents, where they're trying to work and ensure that their children are learning and their children are taken care of, and it's really difficult for everybody. And we're trying to find ways to be more helpful with that too. We've also learned a lot from what you told us last spring. You said loud and clear that more synchronous learning opportunities were really important, and we heard that. And we heard how important it was to have a common platform, because moving from one thing to another was maddening, and we heard that too. So we've made some changes that I think that would be pleasing to people who experienced the learning in the spring. For instance, we've purchased devices for our K-2 students, so that every K-2 child will have a device at home in the event that we need to do virtual learning next year. We've also purchased devices to ensure that our high school is one-to-one. So every high school student will also have a Chromebook. We were already one-to-one in grades 5 through 8. So we picked a common platform, Google Classroom, for our all of our kids, except for K-2s who will be using Seesaw. We have ensured that everybody has a device, and we listened to you regarding the nuances of the learning experiences and what was really difficult and what needed to be changed. The virtual learning. Um, the virtual learning will take place basically when students aren't in the classroom setting, but here's what'll be different about next year. When we were abruptly called off last year, we made the decision that for the spring, we were really working on maintaining student skills. In the fall, based on all of our learning, because there's been professional development and a lot of collaboration, and we brought in experts and we built upon our own internal expertise, and we know that in the fall, if we are in virtual learning, we are preparing not for maintenance of skills, but for academic progression and for a return to a grading policy. Basically, the grading policy of A through F at the high school and standards-based grading K through 8. There may be some modifications, but we will be returning to assessing student progress based on standards. And as I said, more live synchronous classes, but we're still planning to be extremely flexible. And we are also ensuring that we are giving our staff not only the professional development time that they already have due to the really terrific community support and their 5 additional contract days, but also additional preparation and professional learning time to prepare for all this ahead of them. This is really heavy lifting for our teachers, particularly the blended model, because they are preparing in-person lessons and online lessons, and how you do that is different. It's not the same. You don't just take your in-person lesson and make it online. So that is, so it's expecting a lot out of our staff, and consequently, that's why we want to give them 1 full day of collaboration every week to ensure they have time for learning and working together and planning and doing all of the things that are really critical to ensuring we have a really great experience next year, no matter the format. And then, of course, there's the full online learning, and we'll call that Oregon Online for the purpose of our conversation. And it's an option open to any of the families in our district. It will have live classes also, and will also be focused on academic progression and focused on the same standards that all of our other students are focusing in on. The differences may come, as I'm sure you won't be surprised, is that if there are only, I'll just give you an example. If we only have 5 second graders who are interested in Oregon, whose families are interested in Oregon Online, then we will probably contract with one of the companies that does online learning for elementary students, and they have teachers who are associated with their group. However, if we have 15, 20 second graders whose families want this option, then we would be able to reassign one of our teachers to be able to do this. And that's when the instruction would probably look a lot more like what's happening in the other classrooms. However, whether we do that or not, they are working on the same standards. Special education, there were a lot of questions regarding how we would improve services for our students who have IEPs and 504s. And there have been people working on that all summer. I know that a lot of our students had really great experiences last spring, and some of our students started to completely disengage. And so we are looking at that very closely and creating plans. And if we are able to bring in some students, we would certainly give high consideration to students who have special education needs as being students who could come in, whether they're for individual services or very small group services, meaning 4 or 5 students that have the same need. So social emotional learning has to absolutely be essential for next year. Consequently, we have prepared, our staff members have prepared universal lessons that will be implemented on a 4K12 basis. We will be focusing in on social emotional health, inclusion and anxiety reduction, no matter what our format is. We also know how important it is for students to be prepared for how different school is going to look and feel. And so if we have the pleasure of bringing them back, we will be preparing them for that as much as possible. And our staff professional development will have a beginning of the year focus on social emotional learning and restorative practices. So this is something that we're giving a lot of thought to, including the wellness of our own staff, not just health and safety protocols, but supporting them through all of the changes that are happening right now to everybody. Athletics and co-curriculars. I won't spend a lot of time here, but this is really important to so many of our kids that it has to be a part of the discussion. And that is that right now, public health is requiring, for the sake of safety, that our students, if they're practicing for athletics, must remain 6 feet apart from one another. And there's a 25-person mass gathering limit that applies to athletics. So certainly if you look at a fall sport, let's say we look at football, there is no way to actually play a game with 6 feet of social distancing and 25-person limit for mass gatherings. So we are in consultation with the WIAA and public health. The athletic directors are meeting. Mike Carr has been a great leader in this area for all of us. And we're looking at creative options because we know how important this is to kids, and we want to be able to find a way somehow this year, if safety allows it, for these activities to continue. We know we're going to have to be flexible and adaptable. And here's a great graphic that shows why. If we started off blended and then in 4 weeks we get new information that pushes us into an online model, and then maybe 8 weeks later we get information that pushes us back into blended. I know that sounds horrible. It sounds horrible to me too. But the point is, if we're making our decisions based on the data and the science and safety, this absolutely could happen. So it's important for everybody to know from the outset that we may be moving back and forth between models throughout the school year. So for next steps, here is what our immediate next steps are. And the first is that we'll continue working and refining all of this based on guidance, and it changes. The 6 feet social distancing hasn't changed. However, Dane County measurements and the number of positive cases and the percentage of community spread, that continues to change. And that is impacting the decision-making across the county. So this week was 2 listening sessions for staff and for families and surveys. So we're very anxious to hear from you. We want to give heavy consideration to how all of you feel as families, and certainly to how the staff feels as, you know, our day-to-day partners in providing education. So here are some of the themes. And for those of you who are just joining us, I'm not able to monitor the chat feature. So I want to make sure that you know that, and that because we had, 200 some questions, I can't answer every one of them individually, but they are grouped by themes, and I'll be able to give you as much information as I can. And then we'll hopefully have another one of these soon where I can give you more details. All right. So let's start by talking about logistics. So I already mentioned our social, or we're often referring to it as physical distancing requirements. And I mentioned that those requirements are in place for even within the small group. If our students are in groups of, or a classroom with 15 other students, we will be working to keep them socially distant within that classroom. And will we be able to do it all the time? No. We are going to be able to minimize risk, but certainly not eliminate it, especially when we're talking about young children who simply will need to learn how to do this. And we will be patient and kind and loving, and we will be firm, because their safety is really, really important. I already spoke about the fact that there would be cohort assignments probably based on alphabet so that families can stay together, and that we are still working out the schedule and what a blended schedule might look like. We'd be able to have some information for you very soon, because we completely understand how important a decision is so that you can plan as families. And it's the same for the teachers. Our teachers have to be able to plan their family schedules, and they have to begin planning for the format and what the lessons will need to look like. Masks will be required. They are required, and we'll be working with all of our students to understand why. Because when students have a clear understanding of why, they're much more likely to comply with any requirement that's put before them. And so there's an education component to students and masks. And if they initially refuse, we help them understand why. And most of our little kids really want to please adults and will probably do it their very best to wear their mask. And the only other time where masks are an issue are if there are students who have sensory issues or medical reasons why a mask isn't appropriate, and we will be working on those situations in a case-by-case basis. School supplies won't be shared. And I'm sure some of you are wondering, well, if it ends up being virtual, do I even need to get school supplies? And I would still encourage you to do so, and know that we also will have some that come to school, because we always have generous organizations that donate supplies. So hopefully we'd be able to get all of those to people who need them. For lunch and for recess, if we're lucky enough to have our kids back in the younger grades, they would be having lunch with their same group of 15 or less, and they would be having recess with their same group of 15 or less. So that's an important thing to remember. The older kids, we would be trying to stagger lunches so that there are the least number of people possible in the cafeteria, and we'd be enforcing social distancing. So as far as daily health protocols, well, we would be asking our staff members to monitor themselves based on the symptoms that are related to COVID, and to absolutely not come in if they are feeling even a little bit off. And some of you asked fantastic questions about substitute teachers, and you're absolutely right. We will have problems obtaining enough substitute teachers, especially if we have a positive case. And if we have a positive case, according to what we know about contact tracing right now, whether it's the student or the teacher, that the class and the teacher are 14 days of quarantine. And any adult that has gone into that classroom for more than 15 minutes would absolutely have to be a part of a 14-day quarantine. So it would really only take a couple of cases in a school before we'd have a significant substitute issue. Or in addition to that, if teachers just aren't feeling well and they want to be extra safe, which is exactly what we would want them to do. So we would be prioritizing substitutes in the lower grade levels, because if the teachers of our students who are older, if they're not feeling well and aren't able to be there for the day, we would be able to assign them to something like the Commons, where they're given a seat and they're socially distanced and they can do their work from a virtual spot, as opposed to being right in there with the rest of the group, because their teacher wouldn't be there. We would, as I mentioned, have an isolation room. And I think that'll be a really important part about making sure that any child or teacher who during the day begins to not feel well is able to go to a place that is safe, and the people who, have a sore finger are able to go to a place and know that anyone with COVID symptoms is in a different spot. So that will be an important component too. Related to cleaning and PPE supplies, we will be supplying masks. However, if you would prefer to send your child with their own mask, absolutely fine. We will just have enough masks at school for any student who forgets, or any student who left it on the bus, or whatever the situation may be. We will ensure that masks are available, as will cleaning supplies. We won't be asking our parents to send in cleaning supplies. That is something that we are working on. We're already working on it. And a couple of you asked excellent questions about the chemicals that are used in the cleaning supplies. So anything that we're using will have been tested for effectiveness against COVID. And always the the sheets that tell everybody what chemicals are actually in cleaning materials that will be available for use. So for those of you who are really concerned about what we're using, or you have children with allergies and you want to make sure that what we're using aligns with their allergy, we'll make sure you have all the information that you need. As far as attendance, we would be 100% encouraging families to keep their child home if they have any symptom that could be associated with COVID. And we have to be able to commit to that as a community. And when we do that, we also then can't we can't be taking students or families to truancy court when we're asking you to please stay home if your child is sick. So we will be doing the best we can to monitor attendance, but attendance in the 10 days and those 10 days letters, that will not be a big part of what we're doing this year, because if your child doesn't feel well, please keep them home. That is the way we'll be able to have the rest of our kids in school, is if we can all agree to do that. As far as protocols, quarantine protocols, that will be coming specifically from public health, as I mentioned before. And what I know for certain is that if there's a positive case within a classroom, then that teacher and those students would need to be out of school for 14 days. And of course, there would be notification of exposure. There are things that are required from public health, and then there are just communication components that are just a part of all of us working together well and making sure we're sharing information as much as we can legally and related to privacy concerns. So if someone is exposed, they are 14 days out of school. And if children aren't sick and teacher isn't sick, then we will absolutely continue with online learning in those 14 days. But it's important to note that any exposure is a 14-day quarantine. That's just what will be expected, and that's what will be required actually from public health. And the criteria for shutting down a school, that is something that is coming from public health. They have not given us that yet. What will the fully online option be like? I mentioned it a little bit before, so I'll just see if there's anything else here related to one of your questions. Will it be different from what was offered in the spring? Yes, there will be live options, or live teaching, synchronous teaching options, and that is the same for K2. K2 would also have that opportunity in the fully online or Oregon online option. If we are, whether it's the school is going virtual due to public health, or it's because you've chosen online, either way, there will be a consistent platform and consistent organization. And one of you asked a really reasonable request, and that is, can there be a syllabus that gives us more information about what's coming so that I can help my child plan and prepare moving forward? So that was a great suggestion. We have them for older students. We don't normally have them for younger. So we will be working on that. And what will the process be for switching to a different model? Well, in the meeting I attended with Public Health today, they said that they are looking at models that are being implemented across the country, and then they are taking those models and they are working on applying them using our local data. So they will be able to tell us sometime in the near future what the criteria might be for closing and what the criteria might be for opening. The problem is that criteria doesn't exist right now. So there would be no way for the Oregon School District to make that decision immediately based upon criteria set by public health. Instead, we would have to make that decision based on all of the inputs that I described before, in addition to the information that's coming from our staff and from our families. And the next theme regarding things that people asked about were teachers and staff. And what were we doing to keep teachers and staff safe? And it's really the same protocols that we are using to keep students safe as what we're using to keep staff safe, which is physical distancing, masks, and hand washing. And lowering or limiting the number of students and the number of staff that teachers encounter throughout the day, because that is what will help us ensure that we are keeping an environment that is as safe as it can possibly be. And we are considering whether or not to allow more or to have more sick days. We're looking at the financial impact of more sick days for people. But there is also the Families First Coronavirus Response Act that allows us to provide for people when they are ill. Now, if, let's say, a teacher was exposed and they must quarantine, if they are well and they must just quarantine due to an exposure, then they would be able to continue teaching in an online format. So they wouldn't have to use sick days for that opportunity or for that situation. Substitute teachers, I mentioned it before that yes, there definitely will be shortages, and when there are, we will prioritize younger classes. However, when we surveyed our substitute teachers, we have a large number of them who are willing to come back when school is in person once again. And so we have a really wonderfully loyal group of substitute teachers who really like to be here. And we like to have them here. They're a great group of people. As far as training and tools for teachers, the professional development has already started for the summer. As I had mentioned, we have brought in local experts to talk about best practices related to virtual learning. And we have also connected virtual learning and best practices to some of our broader goals, such as the utilization of universal design for learning, which is a framework that allows teachers to plan lessons for access by students who are at many points in their understanding of the standard. So we are providing training that not only helps for the fall, but also helps support our growth as a district. For example, we have a very strong commitment to creating an equitable school environment and to creating an anti-racist culture. And consequently, our professional development related to equity has continued all summer. Things have moved into a virtual environment, but we remain just as committed, and so do our teachers. We have people who are participating in multiple opportunities over the course of summer to prepare for our journey in the fall, no matter the format, to be creating more equitable learning experiences and a more equitable environment. We really, really have a very committed staff. And then how much input have they had into the process? That was a great question that was asked. As I mentioned, we have 50 teachers just on the academic planning committee, and myself and the school board president and Gina Jonan, our HR director and legal counsel, we meet every week with our Oregon Education Association leadership group, because we want to be able to continue to collaborate, bring ideas forward, talk about what's important. They're great partners in this process. And I'm really grateful for the opportunity to work closely with them as we're trying to figure out what is the safest, best path moving forward for our students and for our teachers. Other considerations. And these are really significant considerations. The childcare challenges. And we know that these are big challenges, and we want to be able to be helpful. And I know that there was a really great question about, could the school district help facilitate bringing families together who want to support one another and support one another in if there is a blended or virtual portion to our school year. And while we can't necessarily connect families, a lot of the questions that were sent in, and a lot of the conversations that I've had with really amazing parents who've called me just to be able to talk about all that is happening and their feelings about it, I think we can find a way for our community to come together and to at least um, minimize some of the challenge that we know families are facing with this extremely rare, thankfully, event that we are all going through right now. And working families, what options are there for families who have two working parents if their kids aren't physically in school? And that is exactly what we're talking about. What can we provide? And who can we we're also wrestling with, if we start off in a virtual way, are there small groups of students that we can bring in to provide supports? And are there things that perhaps we could do for families that we know are two people who are essential workers? I mean, there are all kinds of things that we're considering, but know that safety has to be the number one thing. So we're looking at all of those possible solutions through the lens of what is safest. Internet access. We know that this is an issue, and we know that we handed out quite a few MiFi devices this year, and I hope they were helpful to those of you who had to use them. But there are things that are currently happening that will be very helpful in some of the areas of our school district where internet access is just really challenging. So we're going to have to work through that together. And what can the community do, and what can parents do to continue to help and support? And those were just some of the most wonderful questions that came in, because they were about, what can we do to help make sure that people are getting what they need? And we'll be thinking about that moving forward, as if there are volunteers in the community, what role can they play in helping other families, etc. So we appreciate the generosity of spirit that's very, very evident. I think I just want to make sure that we have covered some of these larger themes. I'm going to go back one more just to make sure. I think we went through all of that. This is the one that I am not sure that we covered. I think I might have accidentally skipped over it, so I want to make sure we get to it. A lot of really good questions regarding the expectations for parents if students are engaged in virtual learning. Well, what we're hoping is that we know how much of it fell to parents in the spring. And if we are in a virtual situation, which is highly likely that it's going to be a major part of some component of next year, that with live synchronous classes, that we will be able to engage the students in a way where it's not necessary for their parents to have to do as much perhaps as they had to do in the spring, particularly for K2, when we know that because they didn't have devices, we were mailing home the packets, and consequently parents were then trying to utilize the packets to provide learning experiences for their children, and we know that was just really, really difficult. So we expect that with more synchronous learning opportunities, that the burden on the parents will be eased. And then what about students who need extra help? And you're absolutely right. We definitely will have students who will just need a little bit an extra boost here or there, and perhaps something that is in addition to working with your teacher during office hours or something of that nature. And that's why we're exploring, will we be able to have opportunities to bring in students perhaps who require short-term intervention in small groups of 2 or 3 or 4 to work consistently with the same adult for an opportunity or 2 during the week. Because if we can bring in students in small groups and bring them in safely, we want to find ways to do it, because we know how much of a benefit that would be to some of our students. Building relationships. The relationships are absolutely foundational to the learning. And we know that, and we have seen evidence of it over and over again. So if we must start the year in a virtual environment, one of our first priorities will be what opportunities are there to begin to build a relationship, which certainly can be done through the virtual environment, although I would say it's more challenging than it is to the face-to-face. But what are other creative ways that we can begin to build relationships? And an excellent example is a friend who has a little one doing summer school classes, and the student was frustrated and said, I didn't even know this person. The student just had an excellent example of how important relationships are. Because when you know your teacher, especially, they're important all the way through, no matter how old you are. But when you're 5, 6, 7, when you know your teacher and you feel really comfortable with your teacher, then you learn to ask questions and you learn to take risks that are very difficult to do without those relationships. So that'll be an absolute priority for us, and we will be very creative in finding ways to do it. Student performance evaluation. How will students be evaluated if they're not in person? We will be working on formative assessments, and that means assessments that check a student's understanding along the way, as well as summative assessments if we are in a virtual environment. As I stated, we'll be working on students mastering standards, not just maintaining skills, mastering new standards. So we will be conducting assessment in different ways that our teachers have been learning about in the best practices in virtual environments classes this summer, but we will be expecting students to be moving forward in their progression, and that will require assessment. Special education students. So students who are in the special education program or have an IEP, they will, of course, receive the services that they are entitled to according to their IEP. And if we have the opportunity, once again, to bring them into school in small groups to receive services, we will be taking advantage of that also. Rotations classes. I'm so glad that people asked about this. One of the questions was, will we still have choir, band, world language, and orchestra? And while we are receiving guidance from DPI related to physical education and choir and band, receiving guidance from them due to the aerosol distribution component that is a part of those subject areas, we will be offering them in every way we possibly can that is safe. Thankfully, in music, there are a lot of standards related to music education that aren't only about performance. And believe me, I'm not saying that we won't have opportunities for enhancing students' performance skills, but we will also have more opportunities to learn the other parts of music that are so critical. So we absolutely expect to have music education no matter what, and physical education. Although if we are in person, it'll be very challenging to do physical education 6 feet distancing and not sharing equipment. That'll be a challenge. But I also have a lot of faith in our physical education teachers, and I know they can find ways to keep kids physically engaged and engaged in their own health without causing themselves health problems by breaking the physical distancing rules, etc. Locker rooms and showers for our older students. Highly unlikely that we will be using the showers this year. And if we do, they'll be with really stringent cleaning protocols. And as far as locker rooms, we will have to be mindful of the physical distancing that would be necessary. And the masks and everything that's necessary everywhere else would be necessary in the locker room also. And then great questions about how do we switch between models? What if we choose a model? For instance, you say to you and your family decides you want to do Oregon online, but a few months in, you decide that that is not working. Well, we request that you give it a semester, but if it really isn't working and you don't want to do it any longer, then we would allow you to switch back into whatever model Oregon is using at the time. And, it could go the other way too. Although, once again, I would suggest that we would do the switching that's necessary at semester, if at all possible. I think what's on a lot of people's minds is if we have to go between models, like blended to virtual to blended, something of that nature, like the slide that we saw a few minutes ago. That's when it would get challenging, I'm sure. But I also know that if we're starting the year with a focus on relationships, then it'll be about the connections that you have with your classmates who are in your small group and the connections that you have with the teacher, and those will be able to sustain us through the challenges that we might experience going from blended to virtual and having to make those types of what could perhaps be an abrupt change. So relationships really are the key. And that's why I said earlier that creativity and giving people opportunities to build those relationships, no matter the model, is going to be a very big focus for when we start school. And then what determines when the district will have to switch models? Well, as I stated, we may not have metrics that will lead us to a determination for the fall at this moment in time. So we're probably just going to have to make a decision in the next week, because we won't know if we are going to be open or closed via metrics for several more weeks. And I know our families can't wait several more weeks to understand what the fall will look like, and our teachers can't wait several more weeks to plan for the fall. So we need to be able to make the call certainly by the first week of August in order to be prepared for what's happening in the fall. However, after public health has had an opportunity to examine the models that are coming from other parts of the country and apply them to the situation in Dane County, I am expecting that over the course of the year, we will have clear metrics for opening and closing school. So that is definitely what I am predicting based on all of my interactions and discussions with public health, whom I'll say once again have been really good partners to us. And the last piece was 4K. So right now, 4K is under the public health guidance related to childcare. And as far as I can tell, they don't plan on changing that. However, I also know that 4K is highly connected to the programming at the elementary schools, and they also have a transportation connection. Consequently, it's very likely that 4K will follow the lead of the Oregon School District. Although Jackie Amlong, the 4K principal, is still working with us on how to make the safest choice possible for our 4K programs also. And I think that means that we have covered all the themes that you put down for us. And I know that there were more specific questions, and I really truly wish that I had all of the time to answer all of them. But I think what that means is that we should have another session where you're able to submit more questions, and I'm able to perhaps get down to more detail, type of detail that I know that a lot of you would really like to have. So what you see on the screen in front of you is the website address for all of the information that we currently have about the fall. So I urge you to take a look, and this session will be recorded and linked there. You'll be able to see the school board presentation from Monday, July 13th on that site. And so I'm hoping that you're able to utilize it to get information, but at the same time, please know you absolutely should expect information to be coming from the district office on a regular basis, because we are partners. We are in this difficult situation together, and I want to be able to give you as much information as possible so that you can make informed choices and so that you can make informed plans. I know how important that is to families right now. And I also want to make the final note is that, if we are virtual when the school year starts, as I said, it'll be all about the relationships we can form regardless of the format. Today I had the opportunity to tour Forest Edge, our newest school, and we should be getting our occupancy certificate in the next couple of days. And it's actually a very beautiful, physically beautiful building. Our students will be very proud to go there, and I'm sure all of you as Oregon School District parents will think it's an absolutely lovely school. But it's not the physical building that makes the school. It's the relationships that our students form with one another and that they form with their teachers. And that's the part that no matter the format, we will do everything we can to preserve, because that's the most critical part of a student's education. It's the foundation for the learning that takes place. So thank you everybody for your time tonight. I really appreciate it, and you will be hearing from me soon. And please don't ever hesitate to call or send questions to me directly, because as I said, we're in this together, and I want you to have the information you need to make a good decision. So thank you and good night.